Hi everyone, I'm Ben from Cranfield Physical Therapy Centre, and today I've got a presentation on falls prevention. So this is inspired by a booklet that was produced by Saga, the Chartered Society of Physiotherapy and Public Health England, and it gives all sorts of great information about what you can do to reduce your risk of a fall, which can be a real risk to a lot of people, particularly as we age, and can cause a huge loss of confidence and cause lots of ongoing issues. So we want to try and reduce the risk of you having to put yourself through that and see what you can do or what you can do to support others. So I've made it as a PowerPoint video that I can speak through and take you through here. And hopefully if there's any little things that you think, I could get onto that and maybe reduce my risk that way, then it could be of real benefit to you. So I hope you enjoy. Let's make a start then. So this presentation I've called Helping to Prevent a Fall, and it's just lots of nice simple tips and tricks and bits of advice that we can go through. So let's start off. So as I just said, as we get older, our risk of having falls, whether that's through fainting or a mechanical trip, so like tripping over a loose object, the risk of that gets bigger. So, and that's quite a dramatic increase. So we want to try and reduce that as much as we can. And falls really are a big problem. Lots of hospital visits, potential need for operations if you have a broken bone. So really common might be a broken thigh bone up in the hip, and we really want to reduce the chance of that happening to all of us. But there is a lot that can be done, and that's what we're going to go through today. So what we can do to reduce all of that happening. So first of all, we've got to think, well, what actually is it that's increasing our risk? And then we can identify those. So if you've had a fall before, particularly a bad fall before, then that immediately puts you at higher risk of having another one. As we get older, we lose muscle mass, so we'll lose our strength. And as this becomes less strong or we become a little bit weaker, then we're also going to be at greater risk. And if you often feel dizzy, lightheaded, particularly if you stand up after you've been sat down for a long time, then that can cause you to faint or lose your balance. Vision problems, obviously, if you can't see objects or barriers that might trip you up. And often needing to use the loo, it might cause people to rush, and as soon as we start to rush, we're at greater risk of falling over. If you don't get enough exercise, your muscles are not going to be as good, balance won't be as good, and so that makes us more susceptible to a fall. And lots of long-term conditions. So for those of us that have, for instance, Parkinson's or may have had a stroke, things won't be working quite as well as they were before, and so that's not going to be good for our falls risk. Alcohol, if you've had a few too many drinks, your reaction times and your motor control is not going to be as good also. And being in a messy environment, and also somewhere that you're unfamiliar with. So if you're out in the shops or walking down the street and there's objects or dangers in your way that you might not know were there. So we can't stop ourselves getting older, but what can we do to help? So if you have had a fall, but you haven't seen your GP or a specialist or perhaps a physio about it, then it probably would be worth going to speak to someone and just getting some personal advice to you and for them to review and see what can be done. And yeah, if you are really worried, make an appointment with a physio, ask your GP about the best routes to do, because it's much better to take some small steps now and act before potentially a really bad fall happening. So muscle strength. 30 minutes of exercise 5 times per week is the minimum guidelines, and there's no age limit on that. We should still be able to tailor it to ourselves with the help of a professional so that you're exercising even if you've got an injury or a long-term condition, that we can exercise around that so you're still getting the benefits. This can also be gardening, dancing, housework, Pilates, Tai Chi. So there's a real wide range of stuff. You don't have to do the same thing 5 times a week. We can mix it up. And specific recommendations, if you're over 65, at least twice a week, you should be doing exercises targeting specific to strengthen your muscles to help reduce the effect of muscle loss as we age. Balance, obviously that's going to be really important when we're reducing our falls risk. So balance needs practice. If you're not trying to practice it, maybe we won't be doing a stance like that guy there. Then this can help prevent our chance of falling and not losing our balance. Reflexes and reaction time. So if you do have a quick wobble, but you can react to it quickly, then you can practice that. So you can make that better. And that will mean if you are out and about and you have a wobble, you can stop yourself from falling all the way to the ground. And physios are really, really good at coming up with an exercise plan that suits you and suits your current level that you could then progress on. And if it is something that you think, oh, my balance isn't so good, go and see a local physio and explain that you're worried and you want a plan to improve your balance, and that could really help. So this is an image that I took from the Saga and CSP, and it's a really nice picture of some really simple and safe exercises that you could do from home starting today if you're safe. But yeah, if you're worried, ask someone who knows, who you can trust, a health professional, and they'll tell you which ones are suitable. But these are some real simple exercises that can be done to get your muscle strength going and also a little bit of balance work. So bone strength is going to be really important. One, to keep us healthy, but also if we do have a fall, we want nice strong bones so that they're at a reduced chance of breaking. As we age, just like with muscles, our bone density, so how strong they are, is going to become reduced. And exercise where we're weight bearing, so where we're putting load through the bones, that's going to make them dense. The bones react to you putting load through it, putting weight through that arm or that leg, and therefore the bone's going to react and become stronger. Also, what you eat is really, really important. So getting enough protein, calcium, vitamin D and vitamin K are probably 4 of the most important ones. But if you are worried about that, then speak to somebody who knows about nutrition, and they can give you some more tailored advice to suit you and your dietary requirements. Take your time. So 60% of falls are going to happen even within your house or within your garden, and that's people rushing around too much. So take your time, particularly this is when people get up and they're rushing to the loo. So if you know this is a problem for yourself, then make sure you plan, make sure you know the route, make sure it's a safe environment and it's clear of hazards, because that's going to really stop your chances of falling. And if you're outside and there's curbs, things to trip over, maybe if you're walking down the road to your car, then there's going to be hazards and stuff that you don't know they're there. So take your time, make sure you've either got someone with you or you can see where there's going to be a problem and plan ahead so you're not going to be tripping over it. Medications, so really, really common if we're taking a lot of medications. This can cause a wide range of things, but particularly low blood pressure or sleepiness could be one thing. And if you are worried about that and you're feeling these side effects from taking too many different medications, then your GP is going to be the best person to speak to and ask for a medication review, and they can have a look over and see what you're taking and why that you might be feeling those effects. Our vision is really, really important. Every year, have a yearly eye exam to make sure that you're staying on top, maintaining your vision, which is going to help you see everything around you and will also prevent your risk of falling. And some other things that are going to help. Make sure your shoes fit well. Don't worn shoes. Your shoes are really important, not just for risk of falls, but also comfort and other injuries. Make sure you've got well-fitting shoes. You're using them a lot of the time, so it's worth getting ones that are really good and suit you. Baggy trailing clothes. So if your trousers are hanging a bit low or they're getting tripped under your shoes, this is going to be something that you can really easily fix. Watch out for and make sure you're not going to trip over them. And keep an eye on your walking. Some people, as time goes by, they find themselves shuffling a little bit, so not lifting their feet high enough, and this is going to really increase your chance of having a trip. So if you're worried or you think your walking could be a bit better, see a physio, see what you can do to improve that, and that will definitely be helpful for you. But what happens, it's going to happen if you do fall, we need to be planned for that. So if you do, try and remain calm, lie still for a minute, try and see, are you injured, are you in pain, and work through to see if you're okay or if you need to call for help. If you're not hurt or you're a bit shocked, stay still, stay calm, and if you feel you're able to, if you're in a place you're familiar with, such as your living room or your kitchen, there's furniture nearby, then you might be able to try and help yourself get up from the floor. If you are hurt or you're injured or in any way unsure that you're not able to get up by yourself, then that's when you're going to need to try and call for help. So this image again is from the Saga and CSP booklet. This shows a technique of how you would roll onto your side, then push up to something like a chair or a low bit of furniture, maybe a coffee table, and then you can bring one knee up at a time and then sit down on that furniture, and that would be a really good way of doing it. Again, a healthcare professional would be really good at recommending someone who can show that through, and you can go and see a physio and actually walk through that in a safe setting so that you're practiced, and that might increase your confidence that if you do fall, that you've practiced the technique of how to get back up again. So, summary. This is another bit that's at the end of the booklet that this presentation was based on. You could take a picture of this summary, and it has a little checklist that are really, really good things that you could do to make sure you're putting yourself in the best position possible. So thank you for watching if you made it right to the end. I've put my email there at Crownfold Physio. So if you've got any further questions or you want to get in touch, then please do feel free to email me at any point. I'll be more than happy to help. And yeah, if you have any questions, do let us know.